Jeff. Hi, I'm Debbie Weinstein of the Coalition on Human Needs. Thanks so much for all of you for joining us this afternoon. Many hundreds of you from all over the country. We're now in day 7 of the federal government shutdown. A swift ending is not in sight, it appears. You're going to hear from expert speakers today about how the shutdown is hitting people, services, communities. I don't know, Leo, if you were going to show the names of the speakers now, this would be a time. I'll say who we're going to be hearing from. We're really delighted to be getting an overview from Devin O'Connor of the Center on Budget and Policy Priorities. We'll get close-ups about how government workers are being affected from Liz Watson of AFSCME, the American Federation of State, County, and Municipal Employees. We'll hear another close-up about the WIC program from Nell Menifee-Leiby of the National WIC Association, and then turning from how people are being affected, we're going to learn from a great expert on the very latest public opinion polling and messaging tips from Matt Hayward of Groundwork Collaborative. And after hearing from all of these, we'll go to questions for these speakers. And as you heard, you can put your questions in the Q&A box and we'll deal with as many as we can. We'll close after that with some important resources to help you share information about the impact of the shutdown and other ways services are being cut or canceled. And that and other resources you'll hear from Dominique Espinoza of CHN. Well, so a little bit of overview. Where do things stand now? The House had passed a stopgap spending bill known as a continuing resolution, or CR for the lingo, that would have provided flat appropriations more or less through November 21st, with a few add-ons, such as extra money for members of Congress security. Then they left town, that's the House, and they're still gone. A clear signal that the House leadership, at least, is not at this point interested in negotiating. On the Senate side, there are 53 Republicans, 45 Democrats, 2 independents who caucus with the Democrats, and the Senate has been taking votes on both the same CR, or stopgap spending bill, that the House passed, and they're also taking votes on an alternative Senate Democratic proposal. The catch: the Senate rules require 60 votes to pass an appropriations bill, so they would need Democratic caucus votes to get there. So far, there have been only 3 Democrats or independents willing to vote with the Republicans to enact the House CR. Those are Catherine Cortez Masto of Nevada, John Fetterman of Pennsylvania, and Angus King, independent of Maine. In addition, Rand Paul, Republican of Kentucky, routinely votes against the CRs. So the the Senate majority has been putting forward the same CR that the House passed. The Democrats have a different version. The Senate one goes through November 21st. The Senate Democrats goes to October 31st, and it has 2 significant add-ons: a set of protections, sometimes people call them guardrails, to limit the president's ability to freeze funds already approved by Congress, and A second big area of add-ons relates to healthcare. In particular, the Democratic CR would prevent the Affordable Care Act's enhanced premium tax credits from expiring at the end of December. They would permanently extend them, and they want to do it now because if insurance companies think that a set of healthy people who can afford it will give up their insurance, that they will tend to raise their rates even higher in advance of the open enrollment program period starting November 1. There are also in the Democrats' version reversal of Medicaid cuts that were previously enacted. So that's what members of Congress have in front of them. President Trump and his administration have said clearly that they want to use the shutdown. They've threatened to lay off, not just furlough many federal workers. They're threatening to withhold back pay to furloughed workers, and they have been canceling approved funding, explicitly targeting so-called blue states. That goes beyond the practices of previous shutdowns and beyond the law in many instances. Trump has already also expressed some openness to doing something about those premium tax credits. So far, they've been insisting on passing a simple CR first. Why not do that? Well, if I'm a seriously injured patient in the hospital, it doesn't solve my problem to fail to address my injuries and send me back home. The current situation in which the Trump administration has been freezing and canceling and laying off since they took office, causing serious injuries to people in programs, demands a cure or the harm will continue. And the imminent drastic increase in health insurance costs and an expected 4 million increase in the uninsured demands a cure too now. This webinar is not mostly about the health provisions, but there'll be another webinar on Thursday, and we'll put information about in the chat so that you can get more detail about the healthcare. But now we want to turn to our terrific speakers so that you can learn about how people are being affected, programs, and what we can learn about public opinion and how we can take action. So let's start with a warm welcome to Devin O'Connor of the Center on Budget and Policy Priorities.
Thank you. The first thing I want to go into before we even talk about specific impacts that we could be seeing are 4 points that I almost always make when I'm talking about shutdowns. They're important to remember because they also, they're not just important things to remember about shutdown, but sort of double for the caveats as to why it's incredibly difficult to speak confidently about what will or won't happen during a shutdown. So at a time when everyone's looking for certainty, what will happen this week? What's going to happen next week? There are lots of things that determine that make it very challenging. And I worked at the Office of Management and Budget during the 2013 shutdown, which was the first shutdown we had in, not quite 20 years. And there was just a lot of relearning about what happens or what doesn't happen as you go along. So, the first point I would make about a shutdown is that the executive branch has some discretion about which activities do or do not continue during a shutdown. And that's because they're given some leeway to interpret the exceptions to the Anti-Deficiency Act about which activities can continue unpaid while a shutdown is going on. But an important point, and this is very important in light of the administration that we have in office today, is a shutdown generally does not provide any additional legal authorities. A federal worker that you couldn't fire a week ago, you're not going to be able to fire because the shutdown is in place. They can't limit the review of actions by federal courts just because there's a lapse in appropriations. And it does not affect their ability to freeze funds or illegally withhold funds once a shutdown is over. the law doesn't really change as a result of the lapse in appropriation when it comes to what their authorities are. What they can do is make determinations about exceptions to the Anti-Deficiency Act. Sometimes you just have funding and activities continue as normal. For much of the government, activities will continue a little bit as normal because the funding has already been provided. But for those programs that depend on the annual appropriations that were not provided to start the year, there can be exceptions. So one common exception is activities that are expressly provided in law to continue, whether there is funds for them or not. And the classic example of this is the Department of Defense's feed and forage responsibilities. They are allowed to go and purchase food for the troops, regardless of whether they have an appropriation from Congress to do it. But those kinds of exceptions that Congress has provided are extraordinarily rare. The most common reason for an activity to continue, again, unpaid, but during the time of a shutdown, are exceptions to protect against the imminent threat to life or property. This is stuff like national security, law enforcement. We have federal prisons. You don't let all the federal prison guards walk off just because there's a lapse in appropriation. Air traffic control, activities like that, where it's commonly understood that if those activities were to cease, people's lives would be put in jeopardy. And sometimes that exception, also there are life-saving activities, that could continue outside of those areas. And so that's often a point of debate. Does this activity need to continue even if there are no funds? The third way that there can be an exception is if there are activities that will prevent significant damage to a funded program. So for instance, you may know the Social Security benefit program does not rely on annual appropriations, but the people who press the button to make sure the checks go may. And so to the extent that there are employees who are needed to operate a program that is funded to keep that program from ceasing just as a result of them not having funding, they may be accepted. They may be allowed to work to prevent damage to the Social Security program, which is funded. And then the last one is probably the most ambiguous one, and the one where the Trump administration has seemed at least to be curious to expand the definition relative to what is normal in the past, is activities that are necessary to discharge the president's constitutional duties, which, for example, often have to do with his commander-in-chief responsibilities. But we've seen in some guidance, stretching that to include things like continuing certain HR functions to control the government that I think most people would say, well, those don't seem like really, those are allowable exceptions, but that's the kind of thing that's worked out over the course of a lapse. And some of those things change over time. So start with point one, which is the executive branch has a lot of discretion, which may change how a shutdown feels or what activities continue or not during a shutdown. Point two is that every shutdown is different. They're very context dependent, both in terms of what time of the year is it occurring and what has happened in the world up until the point where the lapse occurred. So that's because the funding circumstances and the relevance of those exceptions that we just talked about, may be affected by when the shutdown is occurring or even how long it lasts. Also, from a shutdown to another, sometimes there's learning. Sometimes Congress changes the law. So programs will operate differently in the absence of appropriation. Sometimes the federal government manages programs differently to avoid having the same problems from one shutdown to another. So there is a little bit of evolution. Just because something happened in a shutdown the last time we had a lapse does not mean that that necessarily will occur this time. And so there's a little bit of evolution and flexibility. Shutdowns also change over time. Some activities that continue during a shutdown because they're separately or already funded, and that's good, but sometimes they're not fully funded. They may have a little bit of funds that may allow them to continue for a short period of time. And so the reasons, why a program may be able to continue may be very context dependent and may change. And so, you may not be worried about a program in a 2-week shutdown, but in a 4-week shutdown, other questions may be raised. And then the last point is just every shutdown is likely to present new or novel issues that we haven't previously faced. And again, context dependent, things that come up that you would never expect. I remember one issue being when the October shutdown in 2013 started to go late in the month. It turned out that was the period of time in which I think it was Alaskan king crab fishers were being permitted, getting their fishing boats permitted to go out and fish. And if they missed their narrow window in which to have those permits from the Commerce Department and go out and do that fishing, it's going to be enormously destructive to their industry. But, for people who weren't Alaskan king crab fishers. It's not the kind of thing that you're anticipating or thinking about or understanding, but there is a calendar and there's a time of year for lots of different activities that the federal government is involved in that have to be worked out. And so every shutdown is going to be very different and will change over time. So all which is to say, as we talk about, what may or may not be affected, keep in mind that things that are true today may look very different if this shutdown were to continue for 2 more weeks. And the other thing I should say is obviously there's no necessary ending point to a shutdown, but shutdowns are uniformly painful. People start to go unpaid. There seem to be almost like natural limits to how long a shutdown can be tolerated. The longest shutdown we've ever had was a little bit more than 30 days. I think it was 35 days. So in general, they have been, a month or much more frequently, much shorter. And so again, it can be hard to anticipate where we will be, 4 weeks from now and how relevant some of these questions will be. But there are some straightforward interpretations that, at least to date, right, have always been somewhat consistent. So I mentioned Social Security benefits continuing, has always uniformly been the case. People covered by Medicare can still see their doctors. Their health insurance doesn't go away. The funding is just in place for that. It's not dependent on annual appropriations. Medicaid gets what's called an advanced appropriation, meaning that they have at least the funds that they need for the first quarter of this fiscal year that has already been provided by Congress. And so unless the shutdown lasts through the end of December, Medicaid and CHIP will continue to operate somewhat normally. Now, there may be activities around the sides of those or oversight activities or, technical assistance or other things that happen that are very important to the program that cease. But for the most part, those programs are going to continue to operate as normal, and you wouldn't expect there to be significant impacts as a result of the lapse. In education, the largest block grants for special education funds and for Title I schools, those are essentially advanced appropriations. Technically, they're structured so they're given as 2-year awards, but then you're not allowed to access the funds until 10 months into the year. But in essence, the funds for next school year have already been provided. For many of the other large state block grants of education funds that get pushed out to local schools, those funds, at least the first large slug of them were already provided back at the end of July. And so you wouldn't expect that to be a significant impact unless this lapse were to last for quite a long time. Now, that doesn't mean that there aren't smaller programs that might be affected, but the large block grant programs within the education department tend to operate as normal. I think we're going to have someone who speaks to the nutrition programs, and never have I been more glad not to talk about WIC than on a day in which you have to contemplate the idea of tariff revenue being used to support the program and what that means for where it is. And so I'll defer on the nutrition questions to them on WIC, on SNAP. The one thing to know about SNAP is obviously the October benefits were loaded back in September, which in itself, I think, was partly motivated by reactions to funding shortfalls or threatened funding shortfalls in the past. And so we know, in the month of October, benefits are, locked and loaded and have gone out. The question of what happens as the shutdown were to last into the end of this month, that raises lots of novel questions we've never faced before, because SNAP has never not had funding available to make payments during the period of a lapse. On housing, most of the grant programs that operate on an annual cycle, and those funds don't tend to go out in October, meaning that people still have the annual funds they were provided last year and will probably be okay for quite some time. However, there is risk among like the monthly subsidy programs, such as public housing operating subsidies or housing choice vouchers or multifamily assistance contracts, where you could see, the operations of the program depend on how long they have carryover balances, monies they were allowed to carry forward from last year to meet their needs. So in a place like the voucher program, where we know there are significant potential shortfalls in funding going forward just at normal levels, the question about how much carryover balances they have in a lapse, I think, is something that will be raised over time. And should this lapse go for a extended period of time, to go beyond October, for instance, I think people will have to pay careful attention to whether there's enough funding to support all of the people currently relying on vouchers for that period of time. And then programs like LIHEAP is a good example of a program who, normally the funds go out at the end of October, early November to the states, who then, make awards and figure out how to run their programs. And so the other question, if you think that the lapse may in fact end before we get to the end of October, things may be all good. But if in fact, there are lots of steps that need to be taking place along the line so that they can be ready to put those funds out in October or early November. You could see delays and impacts even if the lapse were to end before that, which is important to remember. All of the program steps that may be being delayed, even for funding streams that are protected, it may be the case that there are still going to be impacts or delays or disruptions that can occur because a lapse is going on generally. And so, this last point I want to make, I want to say just very clearly, is very subject to change. And that's thus far through this first week of the lapse, to somewhat a surprise, I think, we've not really seen the Trump administration operating in ways that are that far out of the mainstream when it comes to administering a government shutdown, just from the perspective of public impacts and literally in terms of implementing programs affected by the lapse. All shutdowns are painful because the government is meant to be funded. These are not activities that are meant to stop. But the question of whether they've put a thumb on the scale really strongly to make people feel stronger impacts from the lapse in appropriations or to protect people from those impacts to suit a political goal, that has not yet really been an issue. You haven't heard lots of reports of them doing things in the context of the lapse. And the reason why I keep adding that little extra caveat is the thing you have seen them doing is making a number of threats or doing a number of things that actually aren't related to the shutdown, but that are intended to either threaten that they will do impacts in the shutdown, things they may do later, or things that they're doing kind of anyways, but they have wrapped into their conversation of what's happening as a result of the shutdown. So, for example, you may have heard that the Trump administration canceled energy projects in a number of states, and they just happened to be, I think it was 16 states, all with 2 Democratic senators, not a single one represented by a Republican senator. And they themselves were essentially pitching this as this is being done as retribution for this lapse in appropriations. But when they interviewed the energy secretary, he said, no, these were projects we chose to cancel because we wanted to cancel them. We didn't think they made business sense. Now, whether they were in their legal right to cancel those programs or not, you can actually set aside. But from the perspective of a shutdown, these were not cancellations that occurred as a result of the lapse. These are projects that they wanted to cancel anyway. So yes, they're causing pain, but it's not being driven by the lapse in appropriations. And in the absence of a lapse of appropriations, they've clearly shown that they believe they could do that anyway. You've heard them threaten massive rifts, and I think we're going to have someone much more expert speak to the federal personnel side of this. But again, those are not going to be caused by the lapse. They've been attempting rifts since the beginning of their administration. Rifts meaning the reductions in force, trying to mass layoffs of federal workers. So whether they engage in these lapses or not, that's them pursuing the policies, whether, again, legal or not, oftentimes illegally, pursuing the policies that they want, but not driven by a lapse in appropriations. And so when I say so far, there hasn't really been lots of crazy, or completely surprising lapse impacts where the Trump administration may be doing something out of the ordinary. It's only to say they're doing those things, but they tend to be unrelated to the lapse itself.
Devin, thank you so much. There was an awful lot there. It is prompting a number of questions, which we will get to. But right now I want to turn, as Devin suggested, to our wonderful expert from AFSCME, Liz Watson, to talk about how government workers are affected by what's happened so far and what may be anticipated. Liz, thanks for joining us.
Thank you so much for having me. So as Debbie said, I represent the American Federation of State, County, and Municipal Employees, or AFSCME, and our 1.4 million members provide the vital public services that make America happen. So our members maintain our roads, care for the sick and elderly, make our schools good places to learn, keep our communities safe, and so much more. They include Medicaid and SNAP eligibility specialists, healthcare workers, nursing home workers, hospital workers, home care workers, childcare workers, and many, many dozens more occupations. So I'm going to talk today about the impact of the shutdown on the public services that AFSCME members provide, and also the advocacy that our members are doing to reopen the government by funding public services, fixing the healthcare crisis, and putting workers first. I'm going to do this in the context of the massive cuts to healthcare, food assistance, and state and local budgets that we've already seen as a result of the big ugly law, because those cuts make anti-worker extremist plans to let the ACA premium tax credits expire and take away badly needed federal services and funding just so much worse. It's why AFSCME's president, Saunders, called the shutdown a 1-2 punch, saying that on top of crumbling healthcare access, communities will now lose critical federal services they depend on every day. So we know that the big ugly law meant massive cuts to critical services like healthcare and nutrition, taking away healthcare from 15 million people. And that was a big deal for AFSCME's healthcare workforce and the patients that our members serve, as healthcare employers absorb millions more in uncompensated care. This can mean cuts in the healthcare services that hospitals and other healthcare employers provide, and cuts in the healthcare workforce. And as catastrophic SNAP or food assistance cuts in the law make major shifts onto state and county budgets and take away modest food assistance, this is another, major blow to millions of Americans and to the people and the public that our members serve. So a week or so ago, I was in the Midwest telling a group of our members about these cuts to the public services they provide, all to hand over a giant tax cut to the wealthiest. I shared that the law made over $1 trillion in healthcare cuts to only partially pay for. I took one piece of the tax cuts, the $1.4 trillion in new tax cuts for people earning $500,000 a year or more, and that now anti-worker extremist politicians want to make even more cuts to healthcare. And the boos from the crowd when they heard that tax breaks for billionaires are being paid for by our healthcare were loud and long. It's not right, and it's why we're doing everything we can to stop further cuts to our healthcare. We know these are life and death decisions Congress is making right now. And the same anti-worker extremist politicians have shut down the government and suspended public services rather than funding healthcare. And it's why AFSCME members are telling Congress to reopen the government by funding public services, bringing down skyrocketing healthcare costs, and protecting workers. On average, 1/3 of state funding comes from federal dollars. And here are just some of the AFSCME members' jobs that may be affected because they are federally funded and may be affected in the shutdown. So safety inspectors who enforce workplace safety rules at the state level, state disability determination services workers who determine whether people with disabilities qualify for Social Security disability benefits, and the list goes on. And depending how long the shutdown lasts, you could see more programs that rely on federal funding at risk. For example, SNAP, as you just heard, which helps millions of people in need afford groceries, is currently on track to provide benefits through at least the end of October. But if federal funding is exhausted because of a drawn-out shutdown, benefits could be suspended and workers who provide those benefits could be furloughed. And although, as you just heard, Medicaid is an entitlement, its funding is appropriated. And so while that funding was advance appropriated through the first quarter of FY 2026 in a very long drawn out shutdown, you could see Medicaid programs affected. So a government shutdown adds to the hurt for state and local budgets that are already hurting because now they're going to lose more federal funding. So what does this really mean in our communities? I want to share with you the words of April Swartout, a local union president from AFSCME in Michigan. She said, if Medicaid goes away or ACA subsidies vanish, people in my community will go without care. Kids won't get vision screenings or follow-up appointments. Parents working 2 or 3 jobs won't be able to take their children to the doctor. And we'll see more people end up in emergency rooms because they have nowhere else to go. This isn't just about numbers. It's about a child who can't see the board at school because her family can't afford glasses. It's about a parent forced to choose between paying rent and taking a kid to the doctor. Without the funding to support public services in states and localities, workers may face furloughs and layoffs, further disrupting needed public services. And some states may stretch their budgets to try to cover federal shortfalls or in that federal funding. But the cuts to federal funding from the ugly law just mean that state budgets are already stretched thin. So AFSCME is working hard to ensure that Any bill to reopen the government includes language to pay back states and other federal grantees, like many of the nonprofits you represent, for money they spent to cover shortfalls in federal funding so that they aren't further in the hole when the shutdown is over. This language to pay back states and federal grantees was included in bills to reopen the government in 2013 and 2019 after those shutdowns. But of course, we're not taking anything for granted. On top of this, as you just heard, we have AFSCME members who work for the federal government and are facing the immediate impact of the shutdown as they have been furloughed. We have AFSCME members at USDA, VA, the Voice of America, and many, many more agencies, dedicated public servants who are going without a paycheck. In a totally unprecedented move, the administration announced that it would fire federal workers during the shutdown in an attempt to pressure members of Congress to acquiesce to their demands to pass a funding bill that ignored the healthcare crisis. AFSCME's President Saunders called this a blatant attempt to hold federal workers hostage instead of addressing an imminent extreme increase in ACA premiums on 22 million Americans. AFSCME is now a plaintiff in a lawsuit against the administration's proposed illegal RIFs, reductions in force, firings of the federal workforce. And now you've heard that the Office of Management and Budget is threatening to break the law by refusing to give back pay to federal workers when the government reopens. So AFSCME members are calling on Congress to protect federal workers, fund public services, and fix the healthcare crisis. We're asking Congress to permanently extend the premium tax credits in the Affordable Care Act to ensure that 15 million Americans will not see their premiums go up by more than 114% on average in 2026. When premiums soar, people will drop coverage, becoming uninsured or facing even more financial strain. And it's not just the people who receive the tax credits who are going to suffer. Health insurance premiums will go up for everyone, even those who don't get insurance through the ACA, as hospitals and others struggle to cover billions in uncompensated care costs. For the roughly 179 million workers with job-based insurance, like most of our AFSCME members, premiums could soar by nearly $500 a year for each person covered and nearly $2,000 annually for a family of four. AFSCME members have held dozens and dozens of meetings and events across the country, letting members of Congress know the impacts of healthcare cuts on their lives and the patients they serve. And our members have made thousands of calls and sent thousands of emails to Congress. Over the course of the last week alone, our members made 2,100 calls to Congress. And tomorrow we will go to Capitol Hill with nearly 100 retirees to speak truth to power about the impact of healthcare cuts and the shutdown on their lives and on the people AFSCME members serve. As President Saunders said, enough. It's time to stop playing games with our health, our jobs, and our families. Fund the government, fix the healthcare crisis, put working people first. Thank you.
Thank you, Liz. That was powerful and important for us to hear. We are, of course, running a little long on this, so I want to turn immediately at also thanking people for their thoughtful questions. We'll get to as many as we can, but I want to turn now for more of a close-up on one of those programs that we're worried about, and that's WIC, the Women, Infant, and Children Nutrition Program. Welcome, Nell Menifee-Leiby of the National WIC Association.
Thank you so much for having me, Debbie, and thank you to Leo and Meredith for making this possible, and for Devin and Liz for teeing me up really well. I think a lot of what I am going to say will play nicely with the table setting that they've provided us. So really quickly, I'm Nell Menifee-Leiby. I'm Senior Public Policy Manager at the National WIC Association. For folks who might not be familiar with WIC, the Special Supplemental Nutrition Program for Women, Infants, and Children is a public health nutrition program that provides tailored food packages, nutrition education, and breastfeeding support for really specific life stages. So it's pregnancy and postpartum, and then birth through a child's 5th birthday. WIC serves low-income families at nutritional risk. So really definitionally, the 6.9 million women, infants, and children currently participating in the program are some of the most vulnerable members of our community. We know that new parenthood is really challenging for folks under the best of circumstances, and I would not describe this as the best of circumstances. Up front, I do want to be really clear that right now, WIC remains open for business as usual, but the runway for that to continue to be true is very, very short. WIC is 100% federally funded, and for most of my lifetime, there has been a bipartisan commitment in Congress to fully fund the program. That means that even though it's discretionary, Congress provides WIC with enough resources to serve every eligible family who walks in the door, recognizing that WIC is really important, that it improves pregnancy and birth outcomes, child development outcomes, and lifelong diets in ways that really set up kids for the healthiest possible start. That has also meant that WIC has been generally pretty well protected during government shutdowns, even the prolonged shutdown that we saw in 2018 and 2019. This one is a little bit different, though, because it's at the beginning of a federal fiscal year. That means that the state WIC agencies that administer the program don't have any fiscal year 2026 funds on board yet. So they have a very limited amount of funding available to them to keep the lights on and the doors open. On the first day of the shutdown, USDA's Food and Nutrition Service, that's the agency at the Department of Agriculture that administers WIC, sent guidance to state WIC agencies telling them essentially, here are the resources and funding you have available to continue operations during the shutdown, and here's how you can use them. That guidance lays out 4 pots of money. So there is a small chunk of fiscal year 25 grants that state agencies can continue using. There's $150 million contingency fund that USDA has distributed to state agencies to support continued operations. State WIC agencies get rebates from infant formula manufacturers in order to cover part of the cost of infant formula that is purchased with WIC benefits on the program. And all of those resources together, we believe will provide about 2 weeks worth of funds for WIC to continue operating. The other option that is available for states is that their state governments can float WIC, either out of their general funds or using appropriated funds. But as Devin and Liz both covered really well, state governments are already quite strapped right now. They do not budget to cover for WIC in their annual funding bills. This is not the kind of program that they usually have to pay for because it is 100% federally funded. And there are some states that just don't have the resources or the mechanism that would allow them to do that. State agencies did receive reassurance from USDA just yesterday that their states would be reimbursed for state funds that were used to float WIC during a government shutdown. That has also been the case in the shutdowns in 2013 and 2019. So that's good to see. We have seen, for example, Colorado, Connecticut, and Hawaii, their state governments have already promised to provide for continuing operations through October. But again, that's not an option available to everyone. As Devin also alluded to, we have had some late breaking news that the administration is going to transfer some tariff revenue in order to cover continued WIC operations. I will say candidly, just myself and 800 of my closest friends, that I only learned about this like 20 minutes before getting on this webinar. So we don't know all that much yet. We don't know how much money this is or when it will arrive in state WIC agencies' bank accounts. I would say we are glad to see additional resources provided to the program to continue serving families. But it's also important to ensure that this is not a robbing Peter to pay Paul situation. And really, at the end of the day, Congress is the one who holds the checkbook. Congress is responsible for fully funding WIC to ensure that every eligible family can be served. And it's really important for Congress and the White House to come together to find a solution that will ensure that appropriated funds end up where Congress has dictated that they should go and will stay there. And that includes fully funding WIC. If that doesn't happen, we would be in a crisis the likes of which WIC has not faced in my lifetime, where families may have to be turned away from the program. And we know that once we lose the opportunity to reach families during the really critical life stages that WIC serves, we often don't get them back. The worst case scenario is that state WIC agencies would have to cut off WIC benefits that we know families are entitled to and are signed up to receive. But there is enough time left for Congress and the White House to come together to avoid this crisis. I'm gonna drop an action alert in the chat. This is a pre-drafted letter to your member of Congress. Please do use this resource to tell your both your House reps and your senators, for those of you who are lucky enough to have them, unlike me in DC, that WIC is a program that you value and you would like to see Congress fully fund and protect moving forward. And I really appreciate the opportunity to be here and to share with you all today. Thanks so much, Debbie.
Thank you, Nell. Right. Well, a lot of late breaking news that's hard to figure out altogether. And I know people are asking questions, how can I find out more about what's happening? And we're all kind of in a similar state trying to share that information with you. But right now, I do want to turn to Matt Hayward from Groundwork Collaborative, because the ability to have a good end to this unfortunate situation does depend on members of Congress understanding what public opinion is, people like us understanding that and speaking as persuasively as we can. And Matt, with all the polling that you can refer to, you're the person to help us figure that out. Thank you.
Thanks, Debbie, and great to be with everyone today. So I'm Matt Hayward. I'm joining from Groundwork Action, and we actually just got poll results back from polling that we conducted over the weekend, October 3rd to 6th, on how voters are feeling right now about the shutdown that we're in right now. So I'll just walk through a bit of that. First thing, voters are paying attention to this in a very crowded media environment. And they really started tuning in just in the last couple weeks. So when we asked over the weekend, 82% of voters say they've heard a lot or some about the ongoing government shutdown. This is up 11 points just from when we asked immediately before the shutdown. It's up 35 points from when we asked 2 weeks ago. So people are paying attention here much more than they have in previous fights, such as the reconciliation fight over the summer. And then when asked who they blame for the shutdown, voters are more likely to blame Trump and Republicans in Congress by a 17-point margin. There is still a decent share that are blaming both parties, 20% in our latest polling. And interestingly, 1 in 3 Republican voters say that Trump and Republicans in Congress bear at least some blame. You only see 22% of Democrats saying that Democrats in Congress bear some blame. Let's look at how that's changed over time. Now, we've asked this question in 4 surveys, and for the 3rd week in a row, voters blame Trump and Republicans over Democrats in Congress by a double-digit margin. We have seen some movement as people kind of go to their usual partisan camps, with fewer people blaming both parties equally. That's down by 9 points. But we have seen an increase in blame on Democrats in Congress that's really just driven by Republicans kind of returning home to their position. You're seeing still about a 10-point gap in blame, even as that movement's been happening. Now, let's talk about what people think about healthcare. At this point, while it's not as much as people have heard about the shutdown, 55% say they have heard a lot or some about how health insurance premiums will rise because of the expiring ACA premium tax credits. And voters are very concerned about this. 73% of voters say they are either very or somewhat concerned about rising health insurance premiums. 45% say they're very concerned. And this really cuts across party. While it's a little higher among Democrats, you still have Republican voters by a 2-to-1 margin saying that they are concerned about rising health insurance premiums. So what do they want Congress to do? By a 53 to 34 margin, voters say Democrats should only vote for a bill that reverses Republican healthcare cuts, quote, even if that means the government shutdown continues. This is a big priority for voters, especially for Democratic voters. They agree with that statement by a 69-point margin. Independents also agree by a 15-point margin. And even 30% of Republicans agree that Democrats should only vote for a bill that reverses Republican health care cuts. Now, we've talked a bit about the threats to federal workers and also the threats to WIC. What we found in our public opinion polling is that voters don't like these threats. And in general, they want to see Congress stand up to these threats. So by a 12-point margin, voters agreed more with the statement that Democrats in Congress should keep pushing for negotiations on government funding and healthcare and stand up to President Trump so that he doesn't make these threats in the future against federal workers, versus those saying that Democrats should stand down to protect workers from the threat. And you see, not only was that strongly held by Democrats, but also a pretty big margin among independent voters as well. Similarly, when we look at WIC, we saw an even bigger gap there, that by a 28-point margin, voters say that they want Democrats to prioritize preventing healthcare price hikes over preventing President Trump's threat to cut benefits and programs like WIC. And again, you see pretty much across the board, interestingly, you even see among Republican voters there that might say more about their investment in WIC than about their feeling about what Democrats should do in this case. Now I want to talk briefly about how we talk about these issues right now. Now we're seeing a lot of things, a lot of rhetoric, particularly around immigrant communities. And the first thing I want to share with you is that when we've done side-by-side message testing, which one do you agree with more? A healthcare cost message actually outperforms a pretty standard immigration line of attack. You can see the messages up on your screen there. So the healthcare message on November 1st, millions of Americans will see their healthcare double if Congress doesn't act. That means people are going bankrupt, trying to get chemotherapy, or being turned away when trying to get their insulin. Republicans would rather shut down your government than protect your healthcare. Key elements there. It gives an urgency, November 1st. It talks about the impact, and it talks about the tangible effect on people. Those are key things for a healthcare message. When you have those key elements by a 15-point margin, people agree with that over a line that Democrats are shutting down the government and holding it hostage until Republicans agree to spend money on free healthcare for illegal aliens and non-citizens. Now, there's also a lot of other things happening in the world right now. I live here in DC, where, we have occupation, where ICE is on the streets. We have the tax bill from this summer. It's okay to bring these things in, but I would say you want to bring it back to a healthcare message if you're trying to have the most persuasive message right now. So we give an example of that. The Trump administration is anything but business as usual, illegally deporting law-abiding immigrants. At the same time, his tax bill keeps millions of Americans off Medicaid and doubles healthcare costs. Democrats are ready to support a bipartisan bill that reopens the government, restores healthcare, and puts a check on Trump's power grab. Against the same immigration message that I showed earlier, that message outperforms by 17 points. And finally, it's possible to just directly counter these immigration statements that are coming out. But the key thing is, you don't want to just call Republicans liars on this. It's more persuasive if you lay out the facts for people. So here's the best line that we found as we were testing various messages to correct some of the misinformation on immigration. Whenever Democrats fight to make healthcare better in this country, Republicans like to derail that by saying, but what if someone not like you gets it? The fact is, undocumented people do not and cannot access or be covered by the Affordable Care Act, Medicaid, or Medicare. Democrats' proposal doesn't change that. Americans are facing premium increases of $300 a month on average come November 1st. Lay out the facts and then bring it back to the impact that people are going to pay more if Congress doesn't act. Side by side with that old immigration message that I showed earlier, outperforms by 19 points. So just to summarize, here's the most persuasive way to talk about the healthcare message. As we talked about, impact, urgency, and tangible effect. And there's a reason this works. The healthcare message, it's durable. This is an issue that's going to keep going on throughout the shutdown fight. It is salient to voters' number one priority, which is affordability, the cost of living, and it's something that's winnable with a clear goal. So that's what I have on messaging, and excited to hear people's questions.
Thank you so much. Boy, there was a lot of terrific information from Matt and from all the previous speakers. We are running late here, but I do want to get to a couple of questions. There are a number of more general questions, such as we know, we have experienced 30, 35-day shutdowns in the past. Does that experience give us some guidance as to what to expect? And I know that Devin said they're all different. But are there, some things that that previous longer shutdown can tell us about things we might be wanting to expect? And because we don't have much time, I'm just going to throw in, use some examples. Someone asked a question about childcare providers in child development centers. Are they going to be required to work without pay? That would be one of the potential impacts. So Devin, let me start with you, because I know you take the overview here, and definitely give others an opportunity to.
Yeah, I mean, I think this one intersects with the personnel question first as a starter. When you start to go 30-something days, you're talking about people who are going to be missing paychecks, federal workers and their families who don't really necessarily have an ability. Not all federal workers are extremely highly paid. Many of them are, janitors or doing other jobs that may be lower income, or really important jobs, high stress jobs. One of the things that was considered to have driven the end of that 35-day shutdown was air traffic controllers, of whom there aren't that many, as they sort of got past the point where they had missed enough paychecks, were starting to call in sick at higher rates than were usual, which started to snarl air traffic across the country. And that was considered to be one of the real, so that there's almost like the government is not meant to be shut down for any period of time. The longer you go, the more things start breaking. And that includes the people who are going without their paychecks, is I guess the way I would frame that. And so the further you go, the more severe the impacts are likely to be, and also the less tolerable the impacts are likely to be. So whether there's any kind of natural limit to a shutdown or not, I don't think you can say, but it would be the case that for the longer the shutdown drags on, I think the more and more you'll see really difficult to swallow impacts as a result.
There
I'll
was
also
a specific.
add
Oh,
real
go ahead
quick
now. Sure.
that this shutdown is a little bit different for WIC because of when it happens in the fiscal year. And I imagine this is true for other programs as well. The 2018-19 shutdown, there had already been one short-term continuing resolution. So programs already had some fiscal year 19 funds on board to support continued operations. Because we're at the beginning of the fiscal year, there are no fiscal year 26 funds available. And so that's part of why we have such a short time frame for continued operations for WIC. And I believe there are other programs that are in similarly dire straits because of that timing issue.
I want to turn right now, and we are running late. First of all, thank all the speakers, but to introduce one with some important resources you ought to know about. That's Dominique Espinoza from CHN. And Leo, I think, is going to help by showing a form that can help us share and get information from you. But Dominique, you tell us if you want to introduce that before the
Yes,
form goes up, you
of
just
course.
go right
And
ahead.
and I've already put it in the chat, the form and a blog that I wrote. I encourage you all to read it. And then the blog also does have the form so you can fill it out. So far, we've collected about 36 stories from people being affected by the shutdown and the ugly big bill or OB3. I pulled some quotes that I think will make you be encouraged to perhaps fill out the form or share it with your community. Um, um, for example, at my clinic, patients are already asking why their appointments are being pushed back for weeks. We don't have staff or funding to see them sooner. Another person says we survived the last shutdown by draining our savings, and this time we have nothing left. One missed paycheck, and this could mean eviction. And if the ACA credits are not extended, our out-of-pocket insurance costs will go up to $15,000. We cannot afford that. So these are just some simple quotes that I pulled out from actually bigger stories that we are compiling. And if you want to share your story or you want to make sure that your community has a voice, you can fill out this form, which you can see on your screen. There is a little description of what is the purpose of the form, what is the type of story we're trying to collect. If you go down, you can put your name and your email, but you can choose to remain anonymous. So that's really important. And if you do share your story and I put it in a blog, I will leave your name out of it. But if you give me permission, we are trying to figure out ways in which we can uplift these stories, maybe in social media blog posts. But you can always remain anonymous. It's important for you to put your state and your zip code so that we have a sense of where these things are happening. And it also just, it gives us a sense of where people are being the most affected. If we scroll down, you can, this form is actually collecting stories from the impacts of impounded or rescinded funds, the One Big Beautiful Bill, and the impacts of the federal government shutdown. So it's a compilation of all the terrible things that are affecting our communities right now. So, and if you're not sure, you can put other and just explain there what you think it is. And you can describe, as you can see, the impact on funding freeze. You can upload any relevant documentation that you have. And I think I give examples if we go a little bit lower. I don't give examples, but I did write them here. If you don't know like what we're looking for, it would be examples of for programs cutting services or closing their doors, like housing, childcare, or adult care. Individuals going without help because of reduced services, staff losing jobs or positions going unfilled, workers being furloughed or working without pay during the shutdown, or food banks struggling to keep up with demand. And of course, hospitals or clinics raising the alarms and about this or closing, and specifically in rural areas. So if you have any of that, or if you're not sure, fill out the form and I will go through it and find the best information possible so that we can uplift our voices and that we can hold our leaders accountable in this time.
Thank you very much, Dominique. That was swiftly done. Right. I see some people in the chat are voicing their willingness to tell their stories. I think that is really important. And we thank you so much for that. We also, someone had asked about, I think I'm going to put this again, had asked for sources of information for what is happening around the country. Let's see if I can do this. Or maybe Meredith, if you can, the shutdown report state tracker. I'm just worried maybe I can. All right, I think I did it again. This is a source, mostly news reports from all around the country, where you can get a sense of what is starting to happen as a result of the shutdown. And we know that it is, you know, a little bit unpredictable depending on how much longer it goes on. The other part of the message that you heard is the shutdown is serious, and it is terrible that workers are affected in this way, that services and people who need the services can be affected. But we also, as I tried to say at the outset, that this is happening because of injuries that have already been sustained and that continue to be sustained because the administration is cutting and canceling funding and firing workers. If there aren't any kind of restrictions and controls so that Congress retains its authority and that appropriations bills really mean something, then reopening government won't help, because the administration will keep taking those autocratic steps. So that's why we ask for you to work with us as we send the follow-up email for this, opportunities to take action, both as individuals and organizations. Thank you so much to our speakers. Thank you for the hundreds and hundreds of people who got on. Let's continue to work together. We've got a lot of work to do. Thanks very much.